In today's video, we're going to be talking about Strattera or Atomoxetine, a non-stimulant medication for the treatment of ADHD. So stay tuned. So let's start with number one. What is Strattera or Atomoxetine? Well, Strattera is actually a selective norepinephrine reuptake inhibitor, and this increases norepinephrine and noradrenaline and to a lesser degree dopamine in the prefrontal cortex. And we've talked about the norepinephrine transport system in other videos, but if you can recall, there are more norepinephrine transport systems in the prefrontal cortex than there are the dopamine transport systems, and dopamine has a greater affinity for the norepinephrine transport systems, and that's how it increases dopamine, by inhibiting the release and reuptake of norepinephrine and dopamine. So when you increase dopamine and norepinephrine in the dorsolateral prefrontal cortex, this has been shown to improve attention, concentration, executive function, and even wakefulness. And when you increase these neurotransmitters in the medial prefrontal cortex, this may actually improve depression symptoms as well. Now, it's important to note that too much norepinephrine stimulation can actually lead to sedation and even some cognitive impairment, and we'll talk about some of that when we get to the side effects later on. And so Atomoxetine or Strattera comes in capsule form, and this capsule can actually be opened up and mixed with food or drink. And so that brings us to number two. What is Strattera or Atomoxetine used for? So Strattera or Atomoxetine was approved by the FDA in 2002, and it's approved for the use in ADHD in children and adults, and that's children 6 years and older. Now, off-label uses for Strattera or Atomoxetine is going to be treatment-resistant depression. And so number three, how long does Strattera take to work? Well, the onset of action or some of its effectiveness can be noted with first-time dosing or the first day that you take the dose. However, therapeutic actions can actually be seen within 8 to 12 weeks. And so therefore, it's important that when you're taking Strattera and you're taking it every day, that you notice that these benefits are going to be cumulative over time. And the therapeutic doses for children is based on weight, and then for adults, your therapeutic dose is going to be anywhere from 40 to 100 milligrams per day. So that brings us to number four. Is Strattera addicting? Well, no, it's not addicting. And in fact, because it doesn't have any increasing dopamine in the mesolimbic area of the brain, there is no reward system activated or even cravings that can occur with this medication. So there is no abuse potential. And even withdrawal symptoms are reported as being very rare with this medication. However, despite that fact, it's still important to taper off slowly. And though withdrawal symptoms have been reported rarely, some of the withdrawal symptoms include the following: rebound ADHD symptoms, irritability and mood changes, fatigue and tiredness, sleep disturbances, nausea and gastrointestinal discomfort, and headaches have been reported. So that's why it's important to just come off and taper slowly with any of your psychotropic medications. And so now let's move on to the side effects of Strattera or Atomoxetine. Well, the most common side effects reported in the FDA trials were split up and divided by pediatric population and adult population. So in the pediatric population, the most common side effects reported are the following: nausea, vomiting, fatigue, decreased appetite, abdominal pain, and somnolence, which is severe tiredness. And remember that too much norepinephrine can cause that somnolence. So if you're experiencing that, you may want to cut the dose back or even consider dividing the dose into 2 doses, dividing the total dose. So if you're on a larger amount of Atomoxetine, you can actually split the dose into 2 doses. Also, patients can also tolerate taking this at night, as there is a cumulative benefit over time. So if you're feeling like you get too much sedation on Atomoxetine, you can also consider taking it at night. And now the most common side effects reported in adult patients are the following: constipation, dry mouth, nausea, decreased appetite, dizziness, erectile dysfunction, and even urinary hesitancy has been reported. It's also important to note that there is a black box warning for suicidal ideation in children and adolescents, and the risk associated with suicidal ideation in the FDA trials was noted at 0.4%, and it was the ages of 12 and younger that these types of reactions occurred. However, the black box warning states children and adolescents, so make sure that you're being monitored for this, and if you're having suicidal ideation, on Strattera or atomoxetine, that you notify your provider and go to emergency room because this is an emergency. So now let's talk about those warnings and precautions with Strattera or atomoxetine. Well, because we're increasing norepinephrine, there can be effects on the blood pressure and heart rate. And so therefore it's important to make sure you're being monitored and that you're checking your blood pressure and heart rate and making sure it's not getting too high. Also, those with cardiac abnormalities or irregular heart rhythms should be monitored by a cardiologist, and make sure you get cardiac clearance before starting atomoxetine or Strattera. It's also important to note that patients with pheochromocytoma, which is a tumor on the adrenal glands, patients with that condition have actually been seen to have severe cardiac reactions such as severe hypertension and tachyarrhythmias, and so therefore taking Strattera or atomoxetine is not advised with patients who have this neuroendocrine condition. It's also important to note that serious cardiovascular events have been reported, though very rare, with Strattera or atomoxetine, and therefore it's important again to make sure you're getting evaluated by a cardiologist or your doctor to make sure you have no cardiac structural abnormalities or irregular heart rates or arrhythmias, because stroke and sudden death by myocardial infarction or heart attack has been reported. Another rare warning and precaution or condition to know about is severe liver injury. And because this can occur, it's important to make sure that your labs are being monitored and you're checking your liver enzymes. It's also important to note that if you see elevated liver enzymes or signs of liver injury, that you stop taking atomoxetine under the direction of your provider. Also, psychotic and manic symptoms have been reported, though again, this is very rare with atomoxetine, especially when you're looking at atomoxetine versus stimulants. Because this is a non-stimulant medication, this will occur a lot less than the stimulants. However, it's still something to be evaluated for, and make sure that if you are bipolar or have schizophrenia, that your symptoms are very well managed with your mood stabilizer before considering treatment for your ADHD. Also, aggressive behaviors or hostility have been reported, so make sure that you're being monitored for that as well. And if you're having a lot of irritability or anger issues while on atomoxetine, that you discuss that with your provider, because that could be one of the side effects that you're experiencing. Again, this can affect urine outflow or urinary hesitancy, so if you're having issues with that, again, make sure you report that to your provider. Also, priapism can occur, and this is also another rare condition that can happen, and that is a prolonged penile erection that is very painful. So if this occurs for you, this is a medical emergency, so make sure you seek treatment right away. It's also important to make sure that you're monitoring height and weight, especially with the pediatric population, because height and weight can get affected with prolonged use of non-stimulant medications and stimulant medications. So that includes atomoxetine or Strattera. It is also important to note that in clinical trials, atomoxetine or Strattera was associated with increasing dilated pupils or mydriasis, and this can actually increase intraocular pressure, and therefore patients with narrow angle glaucoma should probably not use atomoxetine because it can make your condition worse. So let's move on to those drug interactions of atomoxetine or Strattera. Well, atomoxetine or Strattera is actually metabolized by the CYP2D6 enzyme, and therefore you have to be very careful with inhibitors and inducers of that enzyme. And there are a lot of CYP2D6 inhibitors, so make sure you watch out for those here, and also the inducers. Now, more so the inhibitors, because they'll inhibit the metabolism of atomoxetine, making you more prone to those side effects. The inducers will make atomoxetine not work properly because you're inducing the metabolism, and so that could be a factor, but make sure that you're getting this evaluated and doing your drug interaction checks, and I'll make sure to link to the drug interaction checker down below in the description. It's also important to note that the MAOIs or monoamine oxidase inhibitors are contraindicated to be taken with atomoxetine because of the risk of hypertensive crisis and even serotonin syndrome. So you're going to want to make sure that you have stopped taking an MAOI within at least 2 weeks before even starting atomoxetine. It's also important to note the effects of antihypertensive drugs or drugs that are taken for blood pressure. Because atomoxetine can potentially increase your blood pressure and even heart rate, this can make some of your blood pressure medications not as effective. So make sure again that you're monitoring for this if you're taking atomoxetine and are also taking a blood pressure medication. Also, for patients who have asthma and use albuterol inhalers, atomoxetine can actually potentiate those noradrenaline effects from albuterol, What that means is that you may have more increased risk for the tachycardia, the agitation, and the anxiety that can occur with taking albuterol if you're also taking atomoxetine. And also, as a side note, when it comes to increasing gastric acidity, as with the stimulants that we talked about, the amphetamines in particular, food-drug interactions were a problem by increasing and decreasing the pH in the acid environment. But in the FDA trials with atomoxetine, when atomoxetine was taken with medications that can increase gastric acidity, no effects on the bioavailability of atomoxetine were seen. And so therefore, that's why atomoxetine is considered to be safe to be taken with food or drink. And so now my final thoughts on atomoxetine or Strattera. Well, even though stimulants are considered first-line treatment for the treatment of ADHD, non-stimulant options like Strattera or atomoxetine can be very effective for treating ADHD symptoms in both children and adults. And for those of you who can't tolerate stimulants for various reasons, oftentimes you may be able to tolerate something like atomoxetine or Strattera. However, it is still important and prudent for you to weigh out those risks versus benefits, and always consider building skills before using pills, because there are treatment modalities in therapy that can actually help you with behavior management and even task and prioritizing tasks in your work or school day to help you manage your symptoms of inattention and focus. So there you have it. That is my overview on Strattera or atomoxetine. Do you have experience with taking this medication and would like to share it with us? Then go ahead and drop it down in the comment section below, because we learn from sharing each other's experiences. And as always, I thank you all for watching. I wish you well on your mental health care journey and look forward to seeing you all next week.